Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. The focus of presentation is: Can I reduce my heart disease risk? I am a cardiologist. I have been in practice for more than 40 years here in Houston, Texas. I would like to rephrase this question and say, what do I need to do to reduce heart disease risk? So let us look at some of the things that I normally recommend to my patients to reduce their cardiovascular risks. So let us begin with the feature presentation. The major risk factors for heart disease are cholesterol, smoking, hypertension, diabetes, obesity, and family history. We're going to look at the correlation between each one of these risk factors and the incidence of heart disease and what happens when we modify these risk factors as to the incidence of heart disease. That will give us a clear understanding of how much benefit we can get by significantly reducing these major risk factors for heart disease, namely cholesterol, smoking, hypertension, diabetes, obesity, and family history. When we talk about heart disease, 95% of the time, patients we see in the medical practice or cardiology practice are having what is known as the coronary artery disease. That is the atherosclerotic plaque. That is the atherosclerotic plaque blocking those arteries, leading to a heart attack or a myocardial infarction, damage to the heart muscle, and weakening of the heart muscle, leading to heart failure, arrhythmias, and sometimes valve leaks because of heart enlargement and other complications related to this coronary artery disease. So, if you go and see a cardiologist with chest pain, that is what we are most probably looking for as what is causing your chest pain, and in majority of the cases it is due to the blockage of these arteries with an atherosclerotic plaque. All the risk factors add to the rapid progression of this atherosclerotic plaque, which is consisting of cholesterol, platelets, and proliferation of the muscle cells lining the arteries, leading to a bulge and eventually blocking this arterial lumen, leading to the myocardial infarction, angina, chest pain, heart failure, and all these other complications. So, how do we decrease this risk? How can we slow the progression of this plaque buildup in the arteries? And let us look at those factors. And here is a study known as Mr. Fit. You can Google this and read the entire article. They looked at 350,977 men aged 35 to 57 years. And they looked at all-cause mortality, which is reflected here in blue, just looking at their death rates. Then cardiovascular risk, which is represented here in red. Then we have the coronary artery disease represented here in yellow. And of course, stroke in green. And it was plotted against the cholesterol level, the total serum cholesterol level. When the cholesterol level was total cholesterol was below 160, the mortality was 50 per 10,000. But when the cholesterol level went up to 300, the mortality went from 50 to 200 per 10,000 population. That clearly tells you that as your cholesterol level goes up, so does the risk of dying from cardiovascular diseases proportionately goes up. On the other hand, if you were to reduce your cholesterol level from 300 to 200, then you would reduce your risk of heart disease by almost 100%. It goes down from 200 to 200 to 100 deaths per 10,000 population. So the lesson number one is the lower your cholesterol, the better is your chances of surviving from a heart problem or preventing the development of heart disease. Number two, for every 50 milligram reduction in cholesterol, we see a 100% reduction in the heart disease risk. So to answer the first question about cholesterol, here is the proof that by reducing the cholesterol level, we can dramatically decrease the incidence of deaths related to the coronary artery disease. Also, in those patients who already have coronary artery disease, we want to further reduce the cholesterol from 200 to 140 or less, which will bring down the death rate from 100 to 50. So you are reducing the death rate by almost 400% by reducing the cholesterol level drastically to 160 or below. That is lesson number one. Interestingly, this increase in cholesterol level and the relationship to the heart disease is not only seen here in the United States, and as we can see in the Northern Europe, it is much more significant. And as you know, most of the ancestors, the majority of the ancestors came from Europe to the United States. So they have sort of a similar picture here. And these black dots are represented by the United States. And here is the circles which are representing the Northern European population. They have a similar. As the cholesterol level goes up, they use millimoles in Europe. And this is a study from Europe. And as you can see, as the cholesterol level goes up, the mortality goes higher. As the cholesterol level comes down, the mortality decreases. And an interesting thing is the Southern Europe, which follows mostly Mediterranean diet, which is a very popular diet to reduce cardiovascular risks. You can see these little dark triangles. Their mortality is exceedingly low compared to the mortality seen here in the United States and also in the Northern Europe. So by modifying our diet, we can dramatically reduce the risk factors for heart disease and mortality related to the heart disease. And here is the same chart which was shown earlier with this study including 356,000 plus patients. As you can see, the mortality goes exponentially as the cholesterol level goes up. On the other hand, if you modify your diet and add exercise and take medications and then bring your cholesterol level down, you can dramatically decrease the mortality from heart disease, particularly the coronary artery disease. Now let's look at age. Age is also a risk factor for increased morbidity and mortality from coronary artery disease. There's nothing you can do about age. I would just say age gracefully and age with significant reduction in the risk factors. Significant reduction in the risk factors. Let me repeat it again. Significant reduction in the risk factors which we are talking about. As we can see, the mortality goes up exponentially between ages 70 and beyond. Similarly, the major cardiovascular diseases go up significantly in the population age 70 to 100. One interesting observation I should add here is that as we add each risk factor, the incidence of heart disease comes down by age at least 10 years. So if you were supposed to get a heart disease, if a person were to get a heart disease by age 70, If he had hypertension, that person may have a heart disease by age 60. If he had diabetes, that person may have, the same person may get heart disease by age 50s. And if you add high cholesterol on top of that, it is not uncommon for somebody with major risk factors, multiple risk factors, to have heart disease in their 20s, 30s, 40s. You see, the compounding effect of these risk factors is dangerous. So if you have been told you have multiple risk factors, you need to listen to your cardiologist and follow all the advice like it is the gospel, because you want to be alive. And the best way to do that is to dramatically reduce these risk factors. Next in the list is hypertension. Hypertension increases the risk of heart disease by about 15% or so, but more so than the coronary artery disease or heart attacks, the other problems with hypertension that we have to focus include stroke, enlargement of the heart leading to heart failure, then sexual dysfunction, and that is compounded by taking some of the medications given for hypertension like beta blockers, which can reduce your sexual drive. You certainly don't want that, and it can also lead to kidney failure. And we talked about heart attack and of course vision problems because of vascular changes in the eye or the retina. So hypertension is a major risk factor which can easily be controlled with medications and dramatically reduce the risk. By controlling the blood pressure, we can reduce the risk of a stroke by almost 50 to 60%. So if you have high blood pressure, I would suggest you talk to your doctor and get on a good medical regimen to bring your bring your blood pressure down, so you can dramatically reduce the risk of stroke, heart failure, and kidney problems. That is as far as hypertension is concerned. Now let's move on to diabetes. Diabetes is not a very good disease to have, especially if you have high blood pressure, high cholesterol, and you smoke on top of that. You are like a time bomb. Or not you, whoever is in that situation, in that shoes, is like a time bomb. You have multiple risk factors. In fact, there is a saying in the medical field, or I should say in the cardiology field, that if someone has a diabetes, it's almost equivalent to that person having coronary artery disease. The incidence of coronary artery disease is 2 to 3 times higher heart disease in the diabetic population compared to the normal population. 30% higher coronary artery disease, that's the blockage of the arteries causing heart attacks and heart failures. 280,000 heart attacks annually happen in patients with diabetes. Okay, so there is a 60% of increased chance of dying from heart disease among diabetic population. So diabetes is definitely an independent major risk factor for heart disease. Controlling your sugar, controlling your calorie intake, keeping your blood sugar level at normal levels, bringing your hemoglobin level below 7 or even less than that should be the key goal in reducing the incidence and mortality related to heart disease among diabetic. The next risk factor I want to emphasize is smoking. Smoking is not only dangerous to your lungs, smoking is equally devastating to the heart. Smoking can increase the risk of heart disease and deaths related to heart disease by multi-folds, depending upon how much you smoke and depending upon how long you smoke. Before I get into the heart, let us look at some of the major effects of smoking. Smoking produces close to 8,000 different chemicals. Smoking can cause nicotine addiction. Of course, it can cause 10 times the increased risk of developing lung cancer. among smokers compared to non-smokers. And of course, you get nausea, accelerated heart rate, and of course, the heart disease. And here's a chart showing what happens when you smoke. If you're a never smoker, if your risk is zero point 0.2, and if you smoke, your risk is like 1, that means it is almost 5 times higher if you smoke compared to a non-smoker. What happens when you quit smoking? One good thing about quitting smoking is the incidence of heart disease comes down gradually over a period of time, but there's a more recent study that shows if you quit smoking in the early stages, I'm talking about early stages, then within 1 year, your risk of heart disease goes down to that of a non-smoker. Let me repeat this sentence again. If you are in your 30s or 40s and you started smoking 10 years earlier, if you stop smoking at this point, you decrease your risk of heart disease and mortality related to heart disease to that of a normal population by 1 year. However, whatever the damage that is done to the lungs from the smoking, from the nicotine, that is permanent. That is not going to change. But you can dramatically reduce the heart disease risk by cutting down your smoking. So if anything you should be considering is quit smoke, cold turkey. It's a matter of life and death situation. You want to live, I would say quitting smoking is the best option. I know it is not easy. I know it is not going to be simple. I know it is not going to be short answer, but that is what we have to make a determination. In the beginning, we started off with the question, can I reduce my heart disease risk? And I'm telling you what people need to do to reduce the heart disease risk. You can reduce the risk of heart disease many folds by simply quitting smoking. There are a lot of programs promoted by the American Lung Association as far as smoking cessation. Most employers provide you with funds and resources for smoking cessation, and you should take every advantage to quit smoking, because this is a matter that concerns not only you, your spouse, and your children and grandchildren. Let us continue. And here's a beautiful study that looked at people aged 35 to 45. Let's say they had started smoking a few years earlier, maybe 5 years, 10 years. And here's a non-smoker population. If you stop smoking at age 40, your risk is pretty much similar to that of the normal population, as I showed you in the previous slide. However, the longer you wait to quit smoking, if you quit at 60, then your survival rate drops by almost 20%, from 90 to 80, 10%. And look at here, from here, at age, if you stop at 75, it drops from 70 to 40%, a significant drop. That if you had stopped smoking at age 40, by 70, you have a 50% chance of surviving. So the important thing is you want to quit smoking at the early stages in your life. The best time is perhaps before you start smoking. If you had to change your buddies from smokers to non-smokers, I would all vouch for that, because your smoking buddies are not going to come to you when you're huffing and puffing for oxygen, using a tank next to you and smoking at the same time. Family history. What can you do about family history? You can't choose your parents. You can't choose your genetics. What can you do? As you can see in this chart, the risk of heart disease goes up by almost 50% if you have a family history of heart disease. So that tells us that Even before you reach age 20, you are already at a 50% higher risk of developing heart disease by the time you reach age 60 or 65. So, the best time to address the family history and try to redirect your course of your life is by dramatically reducing the human created risk factors, our diet, our cholesterol intake, our smoking habits, our salt intake leading to blood pressure, or drastically controlling your diabetes. When we control all these risk factors, in fact, we say the LDL level should be not 100, 130, it should be close to 70 or 80 in patients with risk factors, family history of heart disease, so that we can dramatically reduce the risk of heart disease and, more importantly, reduce the progression rate, how quickly it progresses. That's something we can modify. Okay, obesity. Obesity increases the risk of heart disease, and along with that, it adds a whole host of medical problems: high cholesterol, high incidence of diabetes, high incidence of vascular problems in the legs, high incidence of arthritis, knee replacement, hip replacement, kidney problems, and liver problems, fatty liver, and the list goes on and on and on. And here's a study showing the incidence of heart failure, coronary artery disease, stroke, based on the body weight. And the gray is the normal person, the red one is the severe obesity. Look at that, 5 versus 17. That is almost 300% increased risk of heart failure. And here we have double the risk of coronary artery disease and double the risk of stroke. So, by just simply keeping your weight under control, I said keeping your weight under control. That means you make sure your weight doesn't get out of control where you have to go on a weight reduction program. And how do we do that? That is going to be based upon our diet, because we don't develop obesity by just breathing air. Obesity comes from genetics. Obesity comes from excess calorie intake, period. Now let's talk about what about those people who have multiple risk factors. As I told you, a 30-year-old person could have diabetes, could have high blood pressure, could have obesity. And when you add these risk factors, you can see the incidence of heart disease proportionately goes up. If you have zero risk factors, your risk could be pretty close to like 2%, 0.2%. Whereas if you add 3 risk factors, it goes from 0.2 to 0.12. That is almost like 5 times higher the risk of having heart disease, heart attacks, and increased mortality. What do I recommend my heart patients? This is not a professional advice. This is not a recommendation for you to follow. You need to consult with your physician as to what needs to be done based upon thorough history, clinical examination, laboratory studies, and looking at your composite picture and deciding what is the most appropriate approach for you. But this is a general educational information for people like us. I usually recommend my patients keep your calorie intake to what your body needs. If you are a computer IT person looking and romancing the 2 double monitors 8-10 hours a day, you don't need 2,500 calories. You can get by 12 to 1,500 calories. Exercise, even just parking your car half a mile away in the parking lot. Don't look for a parking space close to the grocery store. Park at the last parking spot at the grocery store and take 45 minutes of shopping. You combined your shopping, you combined your walking. Think about it. You need to be an intelligent consumer or to make use of your body to produce or reduce risk factors. Relaxation. We are stressed out for nothing. Nobody cares how much money you have when you are not taking care of your family, when you're not spending time with your children. Who cares? You could be the CEO of $1 billion or $1 trillion company, but you spend no time and you don't find time to relax. You're just like a machine. That machine is going to wear off sometime. Even a 747 jet cannot last forever. If your belt size is 32 at age 25 or 30 years, the belt size should stay at 32. Every 2 inches you add to your belt size, you're adding 10, 20, 30 pounds. Let me repeat that again. Every 2 inches you increase in your pant size or belt size, you are automatically 20 to 30 pounds overweight. And that is going to add all the other risk factors: high cholesterol, hypertension, kidney problem, arthritis, and of course the heart disease. Smoking. I know it is exceedingly challenging to quit smoking, but for the sake of yourself, for the sake of your family and your spouse, think seriously about quitting smoking. There's nothing good you can do in your life. I don't care how highly successful you are in your profession, but one thing you can do to yourself, your family, and your children is to quit smoking. There is plenty of help available to quit smoking. And let me tell you, the bathroom scale is your best friend. He is not your enemy. She is not your enemy. The enemy is within us, trying to blame the bathroom scale. The bathroom scale is always like the customer service, they say the customer is always right. An unhappy customer is bad publicity. So your bathroom scale is always right. If it is not right, get a new one. But it is right. And no excuses. Because this is your life transformation recipe. And you want to reduce the risk of heart disease. We have to take charge of ourselves and do certain things to reduce. It's not just, can I reduce my heart disease risk? What do I need to do to reduce the heart disease risk? Put this list on your refrigerator and every morning check the items, what you have done to accomplish that. What have you done to reduce the cholesterol? How much exercise did you do? What was your blood sugar level? What was your blood pressure level? And what is your stress level? When you stare at that every day, it will become part of your life. I hope you never need the services of a heart doctor, a cardiologist. But when you do, make sure that you ask appropriate questions and faithfully follow the advice, because it is your life that we are trying to help modify. And above all, before I conclude, I would say, please consult with your primary doctor. Consult with your cardiologist as what you really need to do based upon your individual history, evaluation, and lab studies to craft out a plan just for you. God wants us to enjoy life. God wants us to live long enough if we take charge of our life and take the appropriate steps that are needed. Thank you so much, ladies and gentlemen. And please do subscribe to our YouTube channel. We have hundreds of videos on heart education on our channel. Please do watch them and please do like and support Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas, and I will see you in the next video.